Hi guys, welcome back to my YouTube channel where we always have health talk. And today guys, I want us to talk about P2. My name is Sally, I'm a clinician, and today I want us to talk more about P2. What do you know about P2? P2, it is an emergency pill which many people uses after having unprotected sex. They don't want to be pregnant, so that's what most people uses. This is my P2 here. I know many people are familiar with it. Yeah, it has these two pills. This is what you take after having unprotected sex. This P2 is not 100% effective. It is about 97% effective. So when you take it, just know that it's not 100% effective. Some people, they take P2 and they get pregnant, and the reason why sometimes it fails to work, when you take long before you, after having unprotected sex, you take long hours before you take the drug. The earlier you take the drug, the more effective it is. For example, when you take the drug immediately after having sex, it is 95% effective. When you take the drug between 24 hours to 48 hours, it is 85% effective. But when you take between 48 hours to 72 hours, the drug, it is 55% effective. So the earlier you take, the more effective it is. So this emergency pill is not supposed to be taken every time you have unprotected sex. If you know you'll have many intercourse, please, it's advisable you take another form of family planning or another form of contraceptive, because you cannot take this P2 every time you have unprotected sex. So it's very advisable, if you know you'll have many intercourse, please choose another form of contraceptives. It should only be used on emergency cases. When you have unprotected sex and you don't want to be pregnant, you just take these two pills. And now let us discuss how to use it. As you can see, these pills are two. There are two ways you can take the pills. You can take the pill immediately after having sex. You take one pill, then you can take the other pill after 12 hours. Or you can take both pills, the two pills, immediately after having sex. You don't have to wait after 12 hours. So you can choose either of them, and both are very effective. So you just choose, either take one tablet, then you take the other one after 12 hours, or you take both tablets at once. That's how you use it. Now let's discuss about the side effects. There are some side effects of the P2. One is you may have slight headache, you may have cramps, you may also have nausea, you may have vomiting. Sometimes you may feel weak. Sometimes you may have irregular menses, which is the most common one. Side effects, sometimes they mimic the signs and symptoms of pregnancy. So it's very wise, when you take P2 and maybe your periods have drained for maybe 2 weeks, you can take home pregnancy test, so which is not very expensive. So if you think that you may be pregnant, you may take a test to confirm if you are pregnant or it's the side effect of the drug. So those are the most common side effects of the P2. And the other thing I want to tell you is that P2 will not protect you from having STI or from having HIV. So if you take P2, don't think that because you have taken P2 it will protect you from having HIV or STI. So you should be very keen when having unprotected sex. So that's all I have to tell you. And also remember that P2 is not a family planning contraceptive. You can not say every time you have unprotected sex you just use P2. If you know you have irregular intercourse, please, I will advise you to take another method of contraceptive. We have other methods of contraceptive, so you may go to a doctor and seek more advice on which method you should take to protect you from pregnancy. That's all I have for today. Please remember to subscribe, comment, like for more videos. Bye.